Good morning, everybody, and welcome to the COVID-19 media briefing on March 24th. First up, we have Mayor Tory. Go ahead.
Well, good morning. We continue to work with Toronto's hospitals and with other healthcare partners and pharmacies to get COVID-19 vaccine shots in as many arms as possible, as quickly as possible. While the work depends entirely on vaccine supply from the Government of Canada, we are making progress. So far, we have distributed 403,902 COVID-19 vaccine doses. We are the first and the only health unit in Ontario to distribute more than 400,000 doses of vaccine. The next nearest health units are Peel and York Region, who have both distributed just over 100,000 doses. So it gives you some idea of the scale of what's been done so far, with more to come. There are more than 28 clinics operating across the City of Toronto today, including the new mass vaccination site in Thorncliffe Park. We announced this clinic with East Toronto Health Partners, including the Michael Garron Hospital, earlier this week, and they opened their doors this morning. And more than 48,159 vaccination appointments have been booked at city-run clinics. Today, we are announcing the Vaccine Equity Transportation Plan. That is a plan that is putting us to work on ensuring that vulnerable residents and seniors can access COVID-19 vaccination appointments by removing barriers that exist for some to transportation and travel to clinic sites. We know that not everyone has access to their own vehicle. We know that financial mobility and health issues may stop people, in fact, from taking transit or even getting a ride to the vaccination clinic, but those very same people must get vaccinated as well. City staff have worked to develop this program, and we continue to add to it and will continue to add to it in order to ensure that these barriers do not prevent seniors from getting their shot. Starting March 29th, the City is piloting transportation options for seniors aged 75 years of age and over by extending service hours for assisted ride services provided by community organizations. We've been working with multiple partners to plan and deliver this program, including Toronto Ride, iRide, Scarborough Ride, Ontario Health Partners, Uber Canada, and the TTC. As we've said throughout the pandemic, it is our partnerships that have been incredibly important to us in delivering many, many different kinds of supports to people, including some of our most vulnerable populations. And this is another way in which we're using those partnerships to reach residents in all of our communities. The City simply couldn't do it alone. The City is providing funding to Toronto Ride, iRide, and Scarborough Ride to provide assisted transportation to eligible seniors, adults with disabilities, and adults who are immunocompromised who reside in Toronto, to and from vaccination appointments in the City of Toronto. So it's those groups to and from vaccination sites inside the City of Toronto. These ride programs deliver their service through a collaborative network of City and Ministry of Health funded community support agencies, and I would like to acknowledge the support given by the other governments to help us put these programs forward. The details of how to book a ride with these service providers is available on the City of Toronto's website, toronto.ca. The program is available now for limited appointments, but will continue to be expanded over the coming weeks as additional resources and capacity become available. This program is intended only for seniors who have no other options for transportation to vaccination sites. And in that regard, I want to take a moment to thank the thousands of family members and friends and neighbors who are helping and who have helped their elderly loved ones and neighbors and friends with both booking their vaccination appointments and with providing a ride to the appointments, to and from the appointments. For those who can take the TTC is finalizing plans for shuttle bus service from Finch Station to the city-run clinic at Mitchell Field Arena starting on Monday. That's the very day that this clinic will in fact be opening. The TTC is also working with the City to distribute 15,000 TTC ride vouchers through a network of partner community agencies across Toronto to provide people who cannot afford a transit fare with no-cost rides to and from vaccination sites starting in April. Uber Canada has also donated $150,000 in the form of voucher codes for individual rides. Starting April the 6th, these vouchers will be distributed to a network of partner community organizations to provide to people who have no transportation options, who live in communities with high rates of COVID-19, and who have challenges traveling to be vaccinated, as well as for some people with differing abilities. We are continuing to mobilize every part of our city government that we can to help people, especially the seniors eligible right now, to get registered and to get vaccinated. We reached out to the TTC's Wheel-Trans service, for example, and asked if they could help, knowing that they have a list of 26,000 Wheel-Trans users, many of whom are seniors. And so Wheel-Trans will be reaching out to their riders via email as well as through other channels, including their newsletter and booking sites, to let them know that vaccine registration is open and how they can go about getting registered. We've worked to set up Wheel-Trans drop-off and pick-up areas at each of the immunization sites and to make sure that these sites are accessible. I want to thank TTC CEO Rick Leary for taking action and working with us to reach out to residents that they can help us reach out to. It's another example of our Team Toronto approach where everybody across the entire whole of government is helping us to achieve our objectives, which are to get as many people vaccinated as quickly as we can and as easily as we can for them. This idea of involving Wheel-Trans and helping with the TTC actually came from the office of Councillor Josh Matlow, and I want to thank his office and him for raising it, because we are all focused in a team effort on getting people vaccinated and working together to get the job done. We've also worked throughout the pandemic to try to protect our homeless residents. We have massively expanded our shelter system to ensure physical distancing and work to combat COVID-19 by implementing all possible health measures. We've moved thousands of people into more permanent housing options from our shelter system, and we've helped hundreds more people move from encampments into safer indoor spaces. Today, I'm announcing that the city, through Shelter Support and Housing Administration, is making $3 million additional dollars available to all shelters, 24-hour respite sites, temporary response programs, and daytime drop-ins to support the implementation of additional infection prevention and control measures recently announced by the city in direct response to the emergence of the variants of concern. City staff continue to work closely with our healthcare partners to roll out vaccination clinics as well at our shelter and homelessness services. We also are working to get people vaccinated by making these additional resources available to ensure that our frontline staff are able to continue to enhance protection for vulnerable residents. So $2 million will go to shelters, respites, and drop-ins for infection prevention and control measures, including the purchase of PPE, to implement updates to the current directive to require eye protection for staff, and medical or 3-layer masks for people accessing services, as well as additional cleaning support and training. It will also fund wage enhancements during outbreaks to ensure that staffing levels are maintained, as well as activities to improve ventilation, such as higher quality HVAC filters or portable air filters. An additional $1 million will go to drop-ins to expand the availability of daytime indoor space. This funding is a combination of federal and provincial support that we have secured, and it will be made available through a call for proposals in collaboration with the Toronto Drop-In Network. A final item on which I would like to report for today is the registration for the Spring Break Camp TO, which was launched yesterday. There are roughly 3,500 spaces available for spring break camps, including the in-person camp option for a week and the daily virtual workshops, which begin the same week of April the 12th. Approximately 62% of the in-person spots were booked yesterday and 30% of the virtual camp spots. So the message is these camp options, the in-person one and the virtual ones, are filling up, but there are some spots available, so that you might go to toronto.ca/campto to register your kids if that is something that is of interest to you. Earlier this year, postgraduate students from Centennial College's Public Relations program approached city staff in strategic communications, wanting to help us in the formidable task of talking to millennials and Generation Z about COVID-19. We recognize this important audience and wanted to help encourage conversations about what young people have been going through since the start of the pandemic. The students conducted their own research, surveyed their own peers, and created a series of 5 podcasts to share personal stories and some expert advice on topics like living safely with family and roommates, financial instability, mental health concerns, online learning, and overall wellness and self-care. City of Toronto communications staff have been supporting this project and sharing the podcasts on the city's social media. We hope the podcasts reach this critical audience and help them with safely navigating the challenges that we're facing. I encourage anybody that is younger or anybody else interested to listen to the COVID-19 conversations on Instagram at centennial_PR or wherever you get your podcasts. We continue to do everything that we can as a city government to respond to COVID-19, which, with the variants, remains a very real threat in our city. And every day, we are stepping up our efforts to roll out the vaccine that we know will save lives, will keep people healthy, and will bring an end to this pandemic. And those things apply whether we're talking about AstraZeneca, Johnson & Johnson, Moderna, or Pfizer in alphabetical order. We just need to get those shots from any of those vaccines and get those vaccines from the other governments and then get those shots into people's arms, and we're doing everything we can and sparing no effort whatsoever to get that done. And on that note, I would like to invite Chief Pegg to give an update on our overall vaccination efforts. Chief?
Thank you, Mayor Tory, and good morning. On Monday, March 22nd, the province of Ontario extended vaccine eligibility to those 75 years of age and older. At 8 o'clock Monday morning, the provincial booking system went live with that enhanced eligibility. On Monday, 18,649 people booked their appointments for vaccination. This is our highest single-day volume yet. Yesterday, another 3,381 people booked their appointments. With the increased supply of COVID-19 vaccine becoming available, we have been able to increase the capacity of our clinics as of this week. Based on the forecasted vaccine allotments, we will continue to increase our weekly capacity moving forward. The city-operated clinics inside the Metro Toronto Convention Centre, Scarborough Town Centre, and the Toronto Congress Centre continue to operate this week with increased numbers of vaccines being administered in all three. As you know, we encountered some challenges on Monday that resulted in longer than normal line lengths, wait times, and processing times within our clinics. Our objective is always to find the optimum balance between maximizing the number of vaccines that we deliver each day with the need to provide a positive client experience for everyone who is vaccinated in our clinics. Our clinic operations team and immunization task force command team worked overnight Monday, ensuring that we put the necessary changes in place to address these concerns. We have increased the staffing levels in our clinics, including adding clinical staff delivering the vaccine, adding clinical support staff who complete all the check-in, aftercare, and check-out processes, and adding a number of additional first responders to ensure that incoming clients are well served. We now provide chairs and drinking water for waiting clients, along with regular interaction with our line management and first response staff who ensure that needs are efficiently met. We added a command officer from fire services and a superintendent from paramedics in each clinic, directly supporting our clinic managers. We have emailed everyone with a confirmed appointment to confirm their appointment times and to recommend that they arrive 15 minutes prior to their appointment. Each of these enhancements was implemented overnight, and I'm very pleased to report that operations on Tuesday were smooth and without any wait or line issues. I had the opportunity to personally meet with a number of folks as they were going into and coming out of one of our clinics on Tuesday, and all of the feedback provided was exceptional. As of this morning, we have expanded services inside the Toronto Congress Centre such that there is indoor space available for people to wait, as opposed to having to wait outdoors. Likewise, our team is working on implementing similar solutions at the Metro Toronto Convention Centre. We are also working hard to create viable solutions at the Scarborough Town Centre location as well, although this is a more challenging task as additional space is not readily available. Our teams will continue to do our best to put the best possible solutions in place. I want to thank each and every client who is arriving for their confirmed appointment 15 minutes prior. This greatly assists us in ensuring that your experience is both timely and efficient. I also thank everyone for limiting the number of support people that they bring with them to the clinic. by bringing only those necessary to assist them in moving through the clinic. Finally, I continue to encourage anyone who requires a mobility device, such as a walker or wheelchair, to bring their device with them for their vaccine appointment whenever possible. We have increased the number of mobility devices we have on site, along with increasing the number of trained healthcare professionals and emergency first responders on site who are available to help anyone who requires assistance in moving through the process. On March 29, we will open additional clinics inside the Malvern Community Centre and the Mitchell Field Community Centre. As of April 5, the clinic location inside the hangar in Downsview Park will also come online. And finally, after April 12th, our final 3 operated mass immunization clinics in the North Toronto Memorial Community Centre, Carmine Stefano Community Centre, and Cloverdale Mall are scheduled to come online. This, of course, is all dependent on the continued availability of vaccine. We are thrilled to be working alongside the East Toronto Health Partners in the launch of the partnership-based mass immunization clinic in the Thorncliffe Park Community Hub. Beginning today, this mass immunization clinic will provide much welcomed additional clinic capacity and will enable us to collectively evaluate a different clinic operating model. Further, we're very pleased to be working with our East Toronto Health Partners to evaluate the effectiveness of extended clinic operating hours in this location. I offer my thanks to the East Toronto Health Partners for their leadership, partnership, and collaboration as we work together to maximize the administration of vaccines across Toronto. This clinic is available for booking on the provincial booking system now. In closing, I remind everyone that vaccinations are only available by appointment and are not available on a walk-in basis. I strongly encourage everyone who was born in 1946 or earlier to make your appointment for vaccination now. If you have an Ontario Photo Health Card, you can book using the online registration system, which can be accessed 24 hours per day at toronto.ca/COVID-19. If you prefer to book by phone, the provincial call centre can be accessed by calling 1-888-999-6488. The provincial call centre is available from 8 a.m. through 8 p.m. 7 days a week. As a result of our increased clinic capacity, there are appointments still available this weekend, including this coming, there are appointments still available this week, including this coming weekend. Please do not call 311 nor Toronto Public Health for assistance in booking your COVID-19 vaccination appointment, as our staff are not able to access the COVAX system on your behalf. Please continue to monitor toronto.ca/COVID-19 for the most up-to-date information on immunizations in Toronto. Thank you. I'll now invite Dr. Davila to provide her update.
Thank you, Chief Pegg, and good morning. Today, I am reporting 484 new cases of COVID-19. 271 people are in hospital. 51 of them are in the ICU. Sadly, since Monday, 7 more people have died from COVID-19. The current number of cases screened positive for variants of concern is 5,668. That's 240 more cases since Monday. As the Mayor referenced, Health Canada has approved 4 vaccines for Canada. 3 are available in Ontario right now. The Pfizer and Moderna vaccines are being given to people through our mass vaccination clinics and by our hospital and healthcare partners. The AstraZeneca Oxford vaccine is available to people aged 60 and over through a number of pharmacies and some family doctors' offices. The AstraZeneca Oxford vaccine has been a hot topic lately, and as a result, people may be concerned about it. I want to remind you that yesterday, Health Canada said that the AstraZeneca Oxford vaccine is safe. If the AstraZeneca Oxford vaccine is what's in the needle, when my turn for vaccination arrives, I will take it happily and without concern. The important thing is to be vaccinated when you are able to be vaccinated. The vaccines currently in use have been approved by Health Canada, having been through their careful and thorough review process. Health Canada's job is to take a long, hard look at the evidence and to review all the data from the clinical trials conducted. They do this to determine the results of receiving the vaccine and to decide whether the vaccine is safe. It's probably worth remembering that just earlier this year, there were some people wondering what was taking so long with the approval process. That's a reflection of how seriously Health Canada takes its work. We're told some people are afraid that there's COVID-19 in the vaccine. There isn't. None. Each vaccine helps your body create antibodies to COVID-19. They can provide protection when the COVID-19 virus mutates, and mutations happen regularly with viruses. Usually, such mutations don't amount to much. But sometimes, as with the COVID-19 variants we're seeing right now, those mutations or changes in the virus can make it easier for the virus to spread. That's why it's important to get vaccinated when you can. Some people are concerned about vaccine side effects. Wherever you get your vaccine, you're kept for observation long enough after your shot to be confident that you're doing fine. If there are side effects, they are usually mild and go away after a few days. The most important thing to remember is that each vaccine is proven to prevent the worst kind of illness. Some people understandably have questions. There are credible places to go to get those questions answered. You can visit our website at toronto.ca/COVID-19. You can call our Toronto Public Health Hotline at 416-338-7600. You can speak with your pharmacist or your doctor, and of course you can always call telehealth. If you have any doubt, ask as part of being ready to take your turn to be vaccinated when the time comes, and so that you can be confident in this valuable, safe, and effective protection. With that, I'll now turn it over to Lavin for questions.
Thank you, Dr. Davila, Mayor Tory, and Chief Pegg. We'll now start the media Q&A. As a reminder, it's one question, one follow-up, and when we do call your name, please unmute yourself. And we do also have staff on the line if you have other technical questions. First up, we have Mark McAllister from City News. Go ahead, Mark.
Thank you very much, and good morning, everyone. Chief Pegg, if I could start with you, obviously with a new clinic opening today and with issues that have popped up earlier in the week at other locations, how confident are you that those issues don't pop up on the first day at a brand new clinic location? And if you could expand on what you said was a different operating model at that location as well.
Sure. Good morning, Mark. I'm very confident. As I indicated in my remarks, we have increased the staffing levels in every aspect, in every function within our city-operated clinics, and we're looking forward to another effective and positive day in all three. The clinic that is opening today in Thorncliffe Park is actually being staffed and operated directly by the East Toronto Health Partners and not by the City of Toronto. So it is their staffing model. These are professionals in this business. I have every confidence in their ability to design and staff their clinics. So I don't believe there's no correlation between the two, so I don't anticipate any impact on the operations in city operated, and like I said, I have every confidence in their ability to operate the Thorncliffe Park. With respect to the different operating model, as you know, and anyone that has watched the virtual walkthrough of our clinics, the city-operated clinics are designed on a standard clinic model whereby each client comes in and the client physically moves through the clinic, comes in and is screened, is registered and checked in, then walks a short distance, sits down at an immunization station, receives their vaccine, is moved from there to aftercare, and then from aftercare to checkout and out of the clinic. Welcome to be accompanied by a caregiver as required, and like we've said, we have a number of healthcare professionals and first responders in the clinic to assist with any mobility concerns. The model that is being evaluated and has been put in place and will be evaluated by the East Toronto Health Partners is one, as I understand it, where clients will arrive and will, in essence, move to one place, and all of those functions of the clinic will move around them. So, different model. I'm curious to see. I have every confidence it will be effective, and look forward to working with East Toronto and the rest of our healthcare partners to evaluate the outcomes of that.
Thank you very much. A question now for Dr. Davila on behalf of my colleague Adrian Gobriel. As of Monday, Toronto specifically has vaccinated approximately 68,000 of its 80-plus residents. Look at the population, that's about 50% of that age bracket, whereby on a provincial basis, it's about 79%. York Region is about 75%. How concerned are you that Toronto is behind the pack, and what else can be done in this city to make sure that the 80-plus demo gets out and gets vaccinated faster?
So Mark, thanks for that question. Let's start off with the fact that the data that we're speaking of is from earlier this week, and since that time we know that there have been thousands more booked, and in fact thousands more that have received their vaccines since then. So, we continue to see that number grow, and I expect we'll continue, that growth should continue such that we're getting more and more of that population vaccinated over time. And one of the key factors behind that are all the supports that are being put into place to facilitate the ability of our seniors in our community to get to their vaccine and to have that done as quickly as possible. Whether it's the efforts that have been undertaken by our colleagues at Toronto Public Library, for which we're very grateful. They're reaching out to their clients to make sure that they're aware of the opportunities available for their vaccination. Whether we're talking about the transportation initiatives just mentioned by the mayor this morning, there are a number of different supports that have been put into place to make sure that every opportunity that can be made available to facilitate access to vaccine is out there, and so that we can get those numbers up. We know that the more coverage we get across all our population, the more protected they will be, and frankly, the more protected the entire community will be.
Thanks, Mark. Next up, we have Matt Bingley from Global News. Go ahead, Matt.
Hi, good morning to both Mayor Tory and to Chief Pegg. Just picking up off of what Mark was just asking about, I'm just wondering, when it comes to your announcement this morning about transportation and additional services, earlier in the week and for the past week or so, we've been hearing that you're seeing slower signups for those demographics, and I'm wondering how many people have indicated to you that lack of transportation is the reason why they have not booked?
Well, I'll start by simply saying this. The best information that we have is that the pace of registration among different groups, including those 80 plus in Toronto, is not dissimilar to other areas of the province. There may be exceptions that are slightly different, but I think if you look at the overall pattern of how we're doing, especially taking into account the large groups of people, first responders and others, that we had to do in this city, extraordinarily large, that others did not have to do in the first stage, I think we're doing quite well. And I think there's every reason to believe, based on both the comments of Dr. Davila and Chief Pegg with the registration numbers, that situation is picking up as more and more people become aware. I think one of the big problems in this city is actually just awareness, because people tend sometimes to be less aware of these kinds of details than might be the case in smaller communities. But I think what we're trying to do is take one obstacle after another, and it's difficult to know which one is a bigger factor in people's failure so far to register of those who have not, and eliminate those. And so the efforts undertaken today to help community organizations give people rides, to give some TTC vouchers, to take advantage of the kind donation of Uber to make Uber vouchers available to people is to say, well, fine, if that is an obstacle for some people, which clearly it would be either financially or otherwise, we will help with that. And because we just want to get those people to the clinic and get them vaccinated and get them home safely, that's the objective. And we're just trying to deal with these things one at a time by making clinics more accessible geographically, by making transportation easier for people to have, so that there can be really no reasons for them not to get vaccinated.
Matt, if I can just, I'll add one point. One of the reasons why I am hesitant to ever give a conclusive number about the number of appointments, that have booked in for a specific day, is because there is a wide range of appointment availability across the calendar, and people are exercising their opportunity to select the clinic location of their choice, the day and the time of their choice. And what we're seeing is, it is spreading out across the calendar. Like I said on Monday, we had 18,649 people, and those are folks 75 years of age or older, booking appointments into those available appointment slots. Yesterday alone, more than 3,300 people booked their appointment yesterday in those same slots. So there is, we notice that people, I think this is understandable. Generally speaking, people will gravitate first to the appointments earlier in the week and earlier in the day, but we're seeing a very equal distribution now of interest, and I would say a continuing increasing number of appointments that are being booked across all of the available appointments. Final point I'll make is, remember that we have additional clinics coming online across the calendar moving out into April. So we're also seeing a number of folks who are choosing to book into available appointment slots at some of the other clinics that are coming online, such as Malvern, after the date it comes online, as opposed to booking into one of the clinics that may be further away from where they live, for example. So there is a significant number of appointments being booked. I'm really pleased with the uptake that we're seeing this week, and that's something that we monitor on a daily basis and are in direct and daily contact with our provincial counterparts about.
Follow-up? Matt, are you there?
Oh, sorry, my internet just kicked me out for a second. Yeah, just to follow up with Mayor Tory, I'm just wondering, it is budget day. I'm wondering how, any indication that you're going to get the money for the budget that Toronto still needs to fill, and how important it is to hear about that today.
Our discussions with the province have been going very well. What gets announced in the budget or doesn't and is saved for a later time, I can't really comment on, but I like the description the Premier offered this morning, which is that they hope it's a budget that covers lives, which to me really encompasses a lot of the supports that people continue to need as a result of the impacts of the pandemic. Livelihoods, which he made reference to, which of course encompasses businesses and the supports that they need and the building blocks we need to put in place for economic recovery. And I would only add to that places to live, because obviously we have a very keen focus in the City of Toronto on affordable and supportive housing, and are hopeful that the province will be strong partners with us in the efforts that we're undertaking to make sure that that affordable and supportive housing is available. So I'm an optimist because the discussions have been going well, but you take it one day at a time, and you take it one budget at a time and one announcement at a time, and I think we're doing very well to get the support we need as a city, and I'm grateful for the support of the two governments in that regard.
Thanks, Matt. Next up, we have David Ryder from the Toronto Star. Go ahead.
Good morning, everybody. First question for Chief Pegg on vaccine, and I'll try and kind of add two things in there if I can. And one is just, we're hearing about more shipments coming in today, and a video of giant skids coming off airplanes, which obviously everybody wants to see. Is there any talk in Toronto of either expanding hours of clinics or of following York's lead and going ahead of the provincial guidelines and starting to vaccinate even younger people? I guess 70 and over would be the next.
Sure. Good morning, David. So I'll say this. With respect to following the guidelines, those are guidelines that are set and determined by the province of Ontario. As you know, our clinics, the city-operated clinics, are booked. We are a client, if you will, of the provincial booking system, and it is the province of Ontario that sets the parameters and the eligibility within that system, enabling people to book. So that is ultimately a provincial decision. Of course, Dr. Davila and the Toronto Public Health team is in constant contact and collaboration with them, but ultimately their decision. With respect to the arrival of additional vaccines, hearing of skid loads of vaccine arriving on airport tarmacs is a good news to me. I certainly like to hear that. We are in the phase now. We are continuing the rollout and the onboarding or deployment, if you will, of our network of city-operated clinics. We have additional clinics coming on board beginning Monday, and then clinics following that. So it is important for us to continue that work, continue to ultimately get all 9 of our clinics onboarded and operating at their planned capacity before we think about expanding those clinic hours. And that, like we've talked about before, that is one of the reasons that is important. It has always been a priority for us to make sure that we are providing as easy and as equal and equitable access to mass immunization clinics across the City of Toronto as we can. And that is the reason why we've done our best to establish a network of clinics that provides the range and as many options as possible. So we will continue that work at the point where we have 9 clinics up and running, and at the point where we're delivering as much vaccine as we can deliver out of those clinics. Of course, our conversation will immediately turn to expanded hours of operation. Now we're going to have the luxury, if you will, or the ability to be informed by some of the experience and the output from the Thorncliffe Park clinic that East Toronto Health Partners is operating, which will be able to inform our decisions moving forward. I very much thank them for that. They've been a strong partner. Dr. Davila and I have had a number of great conversations with them about creating and then leveraging opportunities to evaluate the expanded clinic hour model, and that's something that they are enthusiastically embracing, and we look forward to seeing the results of that. That'll just make our decision stronger and more efficient moving forward.
Thank you. And my next question is for Mayor Tory. Mayor Tory, we've seen stories about how hard hit people in the taxi industry have been. I'm wondering, with your transportation announcement today, I'm seeing talk of Uber being included and some other organizations. I'm not seeing anything about the taxi industry. Are they involved? And if not, why not?
Well, in the case of Uber, their involvement was as a result of a donation they made to make some vouchers available for us to distribute to organizations that could facilitate seniors and others with differing needs to get to the vaccination sites. I'm quite happy to explore. I mean, we're also giving some TTC vouchers, which is an organization that is ours as part of the city government. I'm quite happy to talk to the taxi industry. You'll notice the other organizations that are getting some financial support from us are what I'll call community volunteer organizations who transport seniors to and from different activities and medical appointments in non-pandemic times. And so we're simply making some additional money available so that they can continue to do that work that they do, but they're largely staffed by volunteers, and the money that they get is almost an administrative amount of money. But I'm quite happy to explore whether there's a role for the taxi industry. They, of course, play a role all the time, and I'm sure continue to do so during the pandemic, transporting many people with differing abilities through the city. They're a big part of our Wheel-Trans overall network, if I can call it that, and they are paid for that, and they do a great job. But I will explore that because there's no conscious desire to leave anybody out. It's all hands on deck here, and the taxi industry could be a valuable ally to us in that regard.
We have Mary Helen Rattel from Radio Canada. Go ahead.
Yes, my question is for Dr. Davila. I would like to talk about outbreaks in schools specifically. How concerned are you about that as we enter the third wave? What do you see? We see that there's still little testing being done for asymptomatic people. Do you believe more should be done maybe to prevent these outbreaks? I'd just like to hear your thoughts about the situation.
Okay, yeah, thank you for that question. When it comes to schools, obviously our first and foremost concern is with the health and safety of those in the schools, whether we're talking about the students, the children that are there, or the staff within those environments. We want to make sure that those are good, safe, healthy environments, given that we're in the context of a pandemic. And we have a significant proportion of our staff at Toronto Public Health working in partnership with our schools and the school boards. They have put a number of measures in place, and that is particularly important, as you indicate, in light of variants of concern. So what we've learned over the course of our experience is that when it comes to schools, activity within the school, COVID-19 activity within the school community, is a reflection of what's happening in the larger community. So to the extent that we are able to reduce COVID-19 transmission within the community writ large, we actually see reduced transmission, or reduced activity, I should say, within the context of schools. What we found as well is that when measures are being used optimally, whether it's, all the infection prevention and control measures, screening measures, all the work that we've done in partnership with our schools and our school boards, when those measures are being practiced consistently and regularly and with good discipline, we're finding that even within the context of cases of variants of concern, we actually are seeing that transmission does not happen significantly within school environments. That doesn't mean it never happens, but it does tell you that with good practice, with good infection prevention and control practice, and adherence to things like screening measures and all the stuff that we've put into place, all the measures we've put into place with schools, when they're well practiced, that there really is, that possibility, not just the opportunity, but it can actually happen on the ground, that you can see school environments that are as safe as possible within the context of a pandemic for students and for staff. So we're continuing that work. We're going to continue to monitor, and we'll continue to work very hard to keep those environments as safe as possible.
What's the status of the situation? Are you seeing an increase maybe in outbreaks in school?
Well, certainly since schools resumed over time, we are seeing, a growth in the number of outbreaks over time. However, that is in concert with what we're seeing in the community. That's not a surprise to us. This was exactly what we saw in the fall as well, that activity within the school environment is indeed a reflection of what's happening in the community. Hence, our constant plea, not only for the schools and school community partners to continue to be vigilant about the measures that have been put into place for those environments, but we also call to all Toronto residents to continue to practice the measures for self-protection that we know actually reduce transmission within the community, so that we can keep levels as low as possible within our school communities. Of course, the other element here is that for those who are able to get vaccinated at this point in time, for those who are eligible at this point, I would encourage those individuals to get their vaccine as soon as possible, because it's the combination of those, self-protection measures and the deployment of vaccine that will actually help us reduce transmission within our community, and therefore keep our school environments as safe as they possibly can be.
Thank you. And last question is Lauren Pelly from CBC. Go ahead.
Also a question for Dr. Davila. How concerned are you about the increasing pressure on ICUs in the Greater Toronto Area? Because, we're hearing from physicians on the front lines, there was never much of a break at all between the second wave and the third, that patients are being transferred between facilities. Some are, very full of critical care patients. So if you could expand on your concerns on that, if you have any, and whether or not you think more restrictions are in the cards, even as we're loosening up on outdoor dining and things like that, if you think there will be kind of a rebound to even harsher measures to curtail some of those admissions we're seeing.
Well, in the first instance, of course, I'm concerned about what we're seeing in our healthcare system. And I'm concerned when I hear the stories from our healthcare partners, particularly those who are providing, incredible care within the context of ICUs and critical care units. This is very, very difficult work. I'm not an expert in that arena, but, I've had the opportunity over the course of medical training to observe what happens within our intensive care units, and I'm aware of the kind of care, the level of care that needs to be provided to patients in those settings. It is grueling work, and I'm grateful to our colleagues in ICUs and throughout the hospitals as well. They have been working very, very hard throughout this pandemic, providing that very important health care. Yes, to those who are being hospitalized with COVID-19, and of course, to all the other conditions, right? There are many other people being admitted to hospital for a wide variety of other reasons as well. So this is of concern to us. We have seen what has happened to other healthcare systems around the world when they get overwhelmed with large volumes of COVID-19 patients. This is exactly what we have been seeking to avoid to the greatest extent possible here, and that's why we've undertaken the kind of COVID-19 response you've seen us, engage in over the past, year and a bit now. With respect to what we can do and what I see on the go-forward basis, that's up to us, right? We have learned over the course of the last year and a bit that it is distance, distance, and distance that really makes a difference in terms of reducing transmission. And where distance cannot be maintained for essential reasons, then wearing a well-fitting mask becomes a very important component of self-protection and community protection as well. And then, of course, there's washing your hands. Add to that, the relatively new tool that we have in our toolkit of vaccine. So as people become eligible for their turn for vaccine, I would encourage people to take up that turn as soon as possible. If we put these two things together, combined with a little bit of warmer weather and the opportunity to get outside and to engage in some activity that's a little bit lower risk, we could find ourselves in much better stead. But it really is up to us, all of us together, to do the best we can to reduce transmission so that we can avoid the worst of what may happen and what we have seen in other healthcare systems around the world.
Follow-up? Lauren? Okay, it seems as though Lauren has fallen off, but that brings us to an end. Thank you, everybody, for joining us. Have a great Wednesday.